We're going to have our typical meeting today because I looked back and it's almost 2 years in December.
Over the years here, we have talked about all sorts of different things, wills, funeral arrangements, dementia, and learning that the different stages are going to happen. And there's nothing you can do about it, nothing I can do, nothing doctors can do, that it's just going to be this progressive memory loss, and the brain's just going to lose its function.
We spent some time recently in the last few months talking about what is important to Ruth at end of life, what would be important to her if she dies, and Don and Barb are trying to plan her ceremony or her funeral. What's important to her?
I don't think it's going to be that difficult for you guys to do the planning.
So on one visit we had Marty, the chaplain, come in and talk to us because she knows Ruth really well and she knows what songs she likes. And Ruth said, I love that song, Jesus Loves Me, and I would love to hear that at my funeral.
A lot of people are afraid to talk about death. And then when it happens to them, they're flustered.
Yeah.
They don't know what to do.
Before the dementia really set in, she had everything set up. That's when we did medical director and power of attorney and everything. So Don knew and I knew before she got as bad as she is now exactly what she wanted.
They know what I want. So I don't think about it anymore.
So you feel like a kind of a relief?
Yes. Oh, yes. Yes. Because the thought of nobody knowing what I wanted, that's what's, you know, you get nervous about that.
We wanted to get her to do a will and just trying to get things squared, get things straightened out. I went out to Hillside Cemetery and just started getting involved. That's where her mother is buried. Started talking with the people out there and got everything in order that way. So when the time comes, we feel pretty comfortable that it'll go smooth.
I don't think we have anything left to do till it happens, right?
Right, yeah.
Yeah, well, we got to keep on meeting.
Oh, yes, yes.
Now I can honestly say without crying that what I want for Ruth is just for her to have the peaceful death that she wants to have.